Just putting a poster in a hospital or in a GP surgery isn't the correct approach to be able to get the diversity from the communities. We felt we needed more. We needed to go to those communities to be able to engage with them. And in doing that, we felt that there was a chasm between the NHS and these communities, and Community Connections is that stepping stone in between to actually build the relationship between communities and healthcare.
Every couple of years, particularly in the lifespan of in the life cycle of the NHS, there's a new initiative, a new idea. We're going to do something different, and that lasts for 3 to 5 years, and then something new comes along. Community Connections didn't want to fall into that trap. It wanted to ensure that the relationships and the trust that was built with communities was meaningful and reliable, I guess, and that we were accountable for the work that we were doing.
It was essentially a way for us to listen to the voice of the communities and allow them to actually influence the decision making. And we tried to set it up so that it went beyond just engagement and turn engagement into action and not just stop at consultation stage.
I attended a meeting, which was an all-members meeting within Birmingham Community Healthcare Trust, and I was hearing all these wonderful stories. The one thing I couldn't relate to any of those wonderful stories, it doesn't happen across disadvantaged communities. This silo that we live in, we're suffering. People don't actually have opportunities to actually seek help and assistance if they're ill.
And I'll tell you why. You don't just go into the community and talk about research. You go into the community and you listen, you learn, you understand, you gain trust. And we're doing all of that within that process. Research comes up at about step 7 along the journey. And so we quickly realized that in all that engagement and building relationships, there was far more to this than just research. And so now this is an engagement tool, an engagement approach, and it can actually help us to address health inequality.
The ecosystem we currently live in is actually designed for people. You can pay for a service. So what about those people living in disadvantage, living in an environment they do not know how to get access to services provision? What mechanisms do we need to put in place? They talk about prevention, they talk about protection, they talk about, empowering communities, but poverty always remains the same. And Community Connections is the only seed that's evolving, working with communities, working with organizations. It's actually following what's written on the tin.
I think the USP of Community Connections is the communities that we work with, and the relationships that we have built with the communities. Our directory keeps on broadening and growing each day, and the communities have trust in this model. I think that's what is the most important thing for us, because they believe that this model could be instrumental in improving the healthcare outcomes and contributing towards mitigating some of the existing health inequalities. And I think that belief is what keeps us going. We feel that they're all passionate in bringing that change in the system.
Picking up on the place-based agenda and seeing what happens at a local level as well, that we can make informed decisions and decisions that will work and that will have a long-term impact on communities and that will help us tackle health inequalities effectively.
As we go forward and increasingly focus on providing care in home, providing care in communities, then being able to work with Community Connections as the way that we bring together a whole set of conversations across GPs, social care, mental health and the community and voluntary sector to make sure we're getting it right for citizens, I think is just really exciting, and it's an opportunity I look forward to being able to realise as we work together.
Building trust, building relationships with local communities is not easy, and it takes a lot of energy, it takes a lot of willingness, it takes a lot of resources. I think to build sustainable relationships, you need to provide resources. I think the reason Community Connections is really successful is because it actually does a lot of that work around trust and relationship building, which then kind of supports researchers to go into those local communities and deliver research which is meaningful and purposeful for local communities.
Sati House have also got to know everybody from Community Connections. They're aware of who you are. They also know that you respect their cultural barriers, the stigma around religion, so which is a very big thing at Sati House. So they understand that if there is something that they want to refuse to answer, they won't be questioned. So they feel, it's a safe, trusted environment where they're able to give their feedback.
We work a lot of community, but the community connection is different because I remember 3 years ago when we talked to them and we tell them the situation we are in, that the community connection that time, that they fill the gap that we need that. A lot of people, especially young people, they cannot go to check their diabetes. We did a diabetes test more than 30 children, and imagine 2 of those 30 children, so they are diabetes. But the parents didn't know unless that the community connection bring that service to community. Community life is the bridge between the mainstream service and the community.
But if it wasn't for community connections, I think they would all be scattered around and wouldn't know where to go. And because it's happening in the community, this is the best thing.
I think the great thing about the partnership with Community Connection is about trying to find out what the real conditions are and trying to also do something about it, identifying that mental health is a big problem in this neighborhood. Obviously wages and money is a factor, access to green space is a factor. So having kind of professional support with our partnership has been amazing for the organization.
So ELSA is a screening study for type 1 diabetes, and we wanted to recruit from the community. One of the issues with type 1 diabetes is that when it hits, it disproportionately affects those who are underserved, so ethnic minority and less privileged populations. Community Connections afforded us the ideal way to approach these populations within the West Midlands area, starting in Birmingham and then going out into the region. So through their community clinics, their refugee forums, all of these other engagement activities they do, we were able to access these populations. If we can take research out to these populations, they engage beautifully. So without them, it would have been so hard to achieve what we've done. And it's actually been the sort of the jewel in the crown of the ELSA studies, how we've engaged with the less privileged ethnic minority populations.
Community Connections are really good at being on the ground. They do a lot of consultations and research. They really take their time to ensure that they have a follow-up, the journey of consistency, collaboration, but also trust as well. And so in the future, what we're trying to do with Community Connections is think more about actually where are the communities that don't really get heard? Are there certain marginalised communities whose voices are really shared and shown?
If you talk about people who've engaged with Community Connections, is that they do feel listened to, they do feel valued. There are examples of where change has happened through this piece of work. We can make assumptions about people's knowledge, but actually very often people don't know where to go for the issues that they're facing.
As a GP, it's always been difficult barriers, so we can reach out to one of the hemodialysis patients who turn up, because if they're not connecting with us in the GP surgery, there's no way for us to reach out to them. We have lots and lots of good teams working in the community. It's about connecting them, having an integrated approach towards one goal of providing health, education, health promotion to work with the diversity of the population in Birmingham.
Whenever I'm recruiting for my own research projects, I'm often in contact with Community Connections to make sure that we're hearing from those underheard, underserved voices that Community Connections have got great relationships with. I have worked with Community Connections on our new website, the Church website. It's about to get the input in that. So yeah, from that sort of initial meeting through about 3 years ago, I've sort of been continually sort of working with Community Connections on everything.
We have a particularly diverse community here in Birmingham, and different communities have different health needs and suffer different impacts from the same disease.
Community Connections is the changes that we make are actually going to be delivered in a way that makes services more accessible, more local, more friendly to the people that end up using them.
Community Connections have established some trusted relationships in. But what really strikes me also is the sustainable approach, because not only have they brought in academic researchers, clinicians, the kind of partnerships that you'd want to see, but they've trained up local community people themselves to become community researchers. So that's really having a skill set within the communities themselves. So it's a real legacy and a future employment opportunity, etc.
I'd love to see Community Connections really being the lead on bringing that kind of funding into our communities and allowing them to become community researchers and working alongside them and developing our own residents and citizens and community leaders to be part of that change that we all want to see in the way our health services are delivered.
I chose to support Community Connections because of their commitment to involvement in the community and also being engaged and supporting small organisations in particular. Community Connections has a genuine commitment to doing that. And that's one of the reasons why I want to be involved, because I do believe that partnership approaches to many of the issues we've got at the moment has got to be the best way forward.
Community Connections have shared goals and priorities with us in terms of building a trusted voice and being able to reach out to the community. And them being hosted in the NHS offers a unique perspective from some of the engagement we sometimes get from a council is very different to communities engaging with the NHS.
Partnerships are built on relationships, and this is a very important aspect of partnerships. They're built on relationships where we are built on trust and a shared understanding and intention to improve something. For us, it is about improving health inequalities, and so Community Connections has a commitment towards that as well.
There's been a real generosity of spirit for wanting to amplify the voices of people, and while they've made a great start, I would hope that we could confidently say that services in Birmingham enabled by citizens' voices, that there's a clear line. Citizens have said this, young people have said this, and as a result, this is how we're doing things in Birmingham. That's the impact. That would be the test of Community Connections' success.